Dr. Ryu Sasae, welcome to the Tokyo Living Podcast.
Thanks for inviting me, Sam. It's a really pleasure to be here today.
It's a pleasure to have you on. Now, we thought you'd be a good person to come on and just have a general chat about the medical system in Japan and perhaps some of the struggles that foreigners have dealing with the medical system out here. But to get started, perhaps if you could just give the listeners a bit of a background on your sort of educational and professional journey to this stage and what you're up to work-wise at the moment.
Sure. So I am currently working as the director of Department of International Healthcare at NTT Medical Center Tokyo. My stories are slightly long, but I'll try to keep it short. I went to UK when I was 12, and that was because my father's a diplomat and he just traveled, everywhere. And one of the first countries we went to was UK. And my parents actually quickly left to other parts of Europe, and myself and my brother stayed in boarding school in UK. And I graduated from Nottingham University Medical School, and I finished 2 years of foundation year, so it's like an internship equivalent. And then I finished off the GP training, and I always wanted to become a GP because I just like the ideas of looking after patients holistically, I guess. And I was qualified as a GP in 2010, and I always wanted to go to London. So I moved to London, and I worked as a GP in London for 7 years. And at one point, I thought, well, I felt like, although my career was going quite well, I was a partner at a GP surgery. I felt at one point that something wasn't enough, Life, it felt like life was, I could see my life in 10 years' time. I could see what I was doing. And for me, that wasn't good enough. And when I just came back to Japan, for holiday, my uncle, he was actually the director or ex-director of the hospital of the NTT Medical Center.
Right.
And he was casually just said, "Oh, do you want to work at our hospital? Because we do have sizable number of international patients." And I didn't hesitate so much. I just decided to take Japanese medical exams in 2016, I think it was. And I moved to Tokyo in 2017 for good. And then I've been basically working at NTT Medical Center Tokyo. So it's a little bit funny one. So the Department of International Healthcare basically looks after mainly international patients. So traditionally, our hospital is based up the north of Shinagawa and the south of Minato Ward. So we were looking after quite sizable number of international patients anyway. So I'm essentially responsible for looking after those international patients mainly.
Yeah. And we have had Nick Rennick on the show previously, who works together with you there as well, right?
That's right. He's my colleague. I mean, he's doing pretty well there, and he was also a GP at Australian GP actually, and working right now with me.
Yeah. Oh, great. And a couple of things that are interesting. So your uncle was a doctor. Did he have? And have there been other doctors in your family? You said your parents were diplomats, but was your uncle sort of an influence in terms of getting you into medicine, or how did that sort of come about?
Thanks for asking. Not really. I mean, I don't know about yourself, but when I chose to become a doctor, I was so young because I think that I was in high school then, probably around 16, 17. And I didn't know anything about the world. And one of the reasons I chose medicine, at the time anyway, was because I love, I was good at science and math,
Yep.
and I thought that I was going to go into I thought I didn't want to do research. So when I
Yeah.
start looking at what I really wanted to do, I always like dealing with people,
Yep.
and I think the idea of becoming a doctor sort of um, sounded good to me. And
Yeah.
just so happens that many of my actually good friends at the time, they went into medicine.
Mm.
So I think for me, naturally, I felt like, well, medicine was the right choice for me. And,
Yep.
only when I started working, only started really working as a doctor, it came a realization that it was a right job for me.
Yeah.
So,
Lucky.
uh, yeah, right?
Would
Because
have been a big waste of time if you
right,
discovered that you didn't like it.
exactly,
Yeah.
exactly. And in
Yeah.
retrospective term, I think I always thought it was a good thing because when I mean the medicine is very generic, isn't it? It's not like a
Yeah.
law, which is very different across the country. Medicine is a very generic thing, and a skill that I acquired in UK, it's been a very sort of good. Also, it's applicable in Japan too. So
Yeah.
I
Yeah.
think for me it was a good thing that I
Yeah.
did
And
medicine.
and I actually wanted to sort of touch on that. You moved over to the UK when you were 12, and obviously in native Japanese. How did you go then, sort of going through the rest of your secondary education in English? Were you continuing with sort of Japanese tutelage, or and then also having done your medicine degree and medical training in the UK? How hard was it converting back? I guess first of all with the Japanese medical language and learning before we even get onto the Japanese medical system, how was it sort of learning the Japanese in the medical side?
So answering your first question, I think going to UK and having an education was obviously a totally new experience for me when I first went there. I was 12.
Yeah.
I was 12. I knew nothing. I didn't. Even speak a word of English.
Wow.
So,
Yeah.
and my parents were obviously underprepared for me to go to UK. But yeah, I mean, I guess a kid as a kid, you learn the language pretty quickly. I don't think I was the very first one to learn English quick. I think I got a younger brother who was
Okay.
a year younger, and he was speaking English much faster than I did. But you get through the medical school, and I think that your second question was how difficult was it for me to actually, adapt to the Japanese medical environment? And I could tell you I don't know, the first year I started working in Japan, I think it was a very, different experience in terms of sort of culturally and and mentally too. I think it really got me prepared because in Japan, I think the medical environment is very hierarchical.
Yes.
It's,
Well, I think that's any sort of environment, right, in Japan.
yeah, exactly. But then, I was in general practice in UK, so there was not much hierarchy. So,
No.
you have these receptionists and, the nurses, in a way, almost like on the equal footing. The physio, it's all the same. But in Japan, it just seems like the boss, and it's a very kind of vertically,
Yeah.
this department is very vertically orientated, and so I thought that initially it was a little bit there were for the first 1 or 2 years I felt like, well, is this really the right place to be.
Really.
There was
Yeah.
always that doubt in my mind, but I think as I worked through uh Japanese environment, I think my Japanese first of all got better,
Yeah.
because as you rightly pointed out, I think that medical terms in Japanese and that kind of thing, it was a steep learning curve, and I'm sure it was same
Mm.
for Dr. Rennick when he first came to Japan. So I had the same in some way. I had a similar issues,
Yeah.
but yeah, now Japan is a really great home, and I do enjoy the way the life is. you know.
Yeah. I guess when you talk about that hierarchical system, as you've, I guess, worked your way up that ladder and are now in a more senior position, are you introducing, I guess, some of the culture that you brought from the UK into that system and try and, I guess, break down some of the barriers that might be created by that hierarchy? Have you sort of been conscious about how you're actually fitting into that sort of system?
Uh, I mean, our department is not, I think good thing is that our department itself is a pretty unique in some way,
Right.
so, we look after international patients mainly, and many of our colleagues, and including Dr. Rennick, Dr. Sakama, they had a experience of working abroad, and same as our interpreters, right? So I think in some way we have a kind of small, section where we think much more internationally.
Yeah.
And so sort of we are pretty within the team, we are pretty flat. I mean, Dr. Rennick would actually, he doesn't treat me like a boss at all. And that's the same with interpreters. But I'm happy with that, But I do tell sort of Dr. Rennick to be a bit careful when I'm in front of the other teams or
Sure.
the other colleagues, because I think that there's still that notion of hierarchy within the hospital.
Yeah.
So yeah, but I try not to kind of impose this too much of a hierarchy, because I think to me the teams needs to be be able to, well, I want to be, first of all, be approachable to the team. Because if there is too much of a hierarchy, I think that the teams become less coherent. That's how I feel. So
Yeah.
I mean, I do try to not to impose it. Yeah, but answering your question is that I think I do try to bring a bit of air of English side, but at the same time, I think I need to maintain some air of Japanese. So I say that it's probably mixed,
Sure. Yeah, I mean, if the team that's treating a certain patient isn't coherent and there's issues with the team, then obviously it's going to negatively impact the patient as well, right? And so yeah, I think that integration is definitely important. What other things from, I guess, just from a doctor's perspective, have, I guess, differences that you've seen between the systems between the UK and Japan?
I mean, the healthcare system is very different, isn't it, from UK and Japan? I think that, first of all, the access, to the healthcare system in Japan, the way that patients access the healthcare system in Japan is very different. So, first of all, you can see any physician you want, any specialist you want, right, within Japan. And that's, in some way it's a very fortunate, in some way it's unfortunate, but they have this free access system where they can access any doctors they want. And I think the second difference is that the healthcare is very much driven by the specialists. It could be a urologist or gynecologist, whereas in UK you have a big health, big part of the healthcare consists of primary care and manned by a generalist, rather than the specialist. So I think that's a very sort of different, first of all, in terms of the structure. And, I think that if the patients, I think one of the advantage, obviously advantage that if you manage to get to if you pay as a patient, if you knows exactly what the problem is to start with, then it's a great system. It works very well because you go straight to the right specialist and you get the care that you need. But oftentimes, I think, the Western population sometimes struggle with the system, particularly if you are used to the system like in UK, where you have your own GPs, right? Seeing a generalist, because usually, if you have any medical problems in UK, you see your own GP, right? My GP. That's
Yep,
what they
yep,
say.
yep, yep. Yeah, you'll have your family
Right,
doctor. Yeah.
right. And I think, if you're used to that system, many, I think, Western patients, they sort of struggle to navigate themselves within the system because they're not used to, think, I have this chest pain, but do I go to respiratory physicians or do I go to the heart specialist? It's very difficult to tell. Maybe the Japanese people are a bit more used to it, but I think the Western population and not necessarily always used to that system.
Right. Okay. So I guess looking at that like a practical example, if you were to sort of take like a case study of someone with a specific problem, how would it sort of look different between those two systems, between the UK system and the Japanese system?
So, let's say you have someone um, with a cough, or let's say it's a chest pain, right? That's the example that I've just given.
Yeah.
And, if you have a chest pain, it could be a lot of,
Could be a lot of things.
yeah, it could be a lot of things. I mean, when you look in the medical stuff, it could be breathing issues, we could respiratory issues. It could be an issue with the heart. It could be even an issue with the muscle and bones,
Yeah.
or it could even be a nerves. So it could be a lot of things essentially. And the first thing that you would do if you are patients in UK is to go see your own GP, family
Yeah.
physician, and they'll assess and they'll triage, right? And what happens vast majority of the time is because they're generalists, they're not really restricted to one specialty. They're able to tell what kind of issue that patients have, right? So if it's a pneumonia, they'll treat it as a pneumonia. If it's a heart, they would say, well, it could be your heart, it could be urgent. I'll refer you to the specialist, right? So
Right.
they have that kind of navigation system naturally in UK. Whereas in Japan, you could start to go and seeing the, respiratory physician first. And they say, oh, actually, no, this is not our specialty. You might need to go to rheumatologists. It could be a muscular issue. And they see a rheumatologist. And the rheumatologist say, well, it's not a muscular issue. It could be a heart problem. And, in the end, maybe a heart specialist might say, well, it's mental issues, right? So the patients keep on going round and round, and you can see how frustrating that might be for the patients, right? To some patients,
Yeah.
So I think that there's that sort of a struggle in some way. In Japan, in fact, it's really interesting because, when you look at COVID, where during the pandemic,
Yeah. Yep.
you saw that, and I think this issue became much more pronounced, because with the patients who got a fever, is that doesn't fall into one specialty. But what you found, was that patient didn't know where to go to. There's some patient would have turned up to the hospital directly, and said, well, I got a fever, where to go? And they might be turned away saying, well, it's not really in the evening, it's not my specialty. You need to go elsewhere. And the patient was really confused as to where they really need to go. Whereas in UK, it was much more streamlined, right? If you got a fever, you contact your own GP, So I think in Japan, there's a bit of confusion, especially among international patients during the pandemic, where they really needed to go. And obviously there's a language barrier as well, right?
Yeah.
And not having their own primary care doctors were not, well, I think that some patients really had difficulties accessing the right care during the pandemics.
Yeah. And where does that sort of direction come from? So if a patient is, let's say, experiencing respiratory symptoms, in Japan, would they just straight away go and see a respiratory specialist, or would they see a random general practitioner, not their general practitioner? How does it work? How does that initial contact take place?
Yeah. So you see, this is the thing. Like in Japan, they've not what they call generalists. They've not, some of them are very good because of the experience that they had. They are able to see patients regardless of the specialties, right, in Japan. But unfortunately, that's not standardized in Japan. Why? Because with training. So, in UK, about 40% of the doctors, they actually train. You have it's mandatory for you to have a 3 years of training before you become a GP, right? So you have sort of broad range of, training prior to going to working in the community as a GP. Whereas in Japan, you don't need that training. You don't need that training to actually work in the primary care field.
Right.
So in other words, you can potentially, when you finish your medical schools and internship, without having a specialty, you can go into what they call the primary care, right? So without any training. So that's, I think, number one issue is that, they don't have, many actually end up not having the right training before they work in the primary care field. And the second thing is that many of the primary care physicians in Japan, the way it works is that, they work through their specialties until 40 or 50s. And these are like urologists, respiratory physician, etc. And just, when they turn 50 and it's, oh, my life is a bit hard, what shall we do? And oftentimes at these time, they decide to become a primary care physician, from
really?
working in the hospital. Yeah.
Okay.
So you can just imagine what happens, right? It's these, the urologist or respiratory physician, they then, turn into work in the primary care. And, they call themselves, many of them call themselves a generalist or advertise themselves as generalist. But, usually they have their own specialties.
Yeah.
Right. So what I'm really trying to say, I guess, is that, when you call a generalist in Japan, there's not actually, there are, it's not very standardized. There are some who are really good. Yeah, don't get me wrong there. But I think that generalists in Japan, so they call generalists, are not necessarily always standardized. So we just got to be a bit more careful on that.
Yeah. And is there any, plans, or has there been any sort of move to change that system? I can tell by your face that it's
See,
not really.
That's a really good question, and thanks for asking. So, I think that, this pandemic, it was a real trigger for, for people in some way, because, they did not really have their own GPs or, set doctors they usually see. I think there's a lot of arguments, discussion among the publics more than ever that, they call themselves kakaritsuke, they call it kakaritsuke, which is kind of equivalent of general practice. But there's more discussion now to have so they call the GPs in Japan. But I know for the fact that it's going to be a very slow process. And the reason is that Japan is inherently very slow to change anyway, when they want to. And the other thing is that there's too many stakeholders. There's too many private stakeholders in Japanese healthcare system.
Right.
So all these specialists, in the primary care, they have a business to run.
Yeah.
Right. So if suddenly there's a flood of well-trained generalists flooding into the primary care, that is going to affect their business.
Yeah, for sure.
right? So it's a very sort of a sensitive issues, and the Japanese Medical Association is almost like a lobbying group to some extent, and they really don't want generalists in the primary care fields, and they also have their hand in the political fields too. So it's been, structurally, it's been very difficult. And historically, has been very difficult to change that system. But I'm hoping that things will start to change and accelerate the changes because of this pandemic.
Yeah, yeah. Has there been any other sort of issues that you have seen arise as a result of the pandemic within the system that I guess has been there but not as evident as now with this very different situation that we've been living in the last year and a half?
I guess that you could talk about the ambulances, right? Because we saw in Japan that the ambulances were turned away, when the patients turn up to hospital with a fever, and some patients weren't able to find the right hospital for the right care in time. So I think, to tell you the truth, that's not the new problem. It's only became very apparent during COVID-19. And again, that's a very structural issues, because in Japan, you have so many private hospitals, right? So many. And then doctors essentially spread very thinly across the hospitals. So, for example, in UK, we have probably in London, we only have about 13 hospitals, but very big one, right? Huge hospitals. Whereas, when in Tokyo, you have about 300 private hospitals, right? So you can imagine how, even if you have the same number of doctors, the doctors are very, thinly spread out within Japan. And what really happened, and also in addition to that, as I explained, they have their own specialties, right? So they only look after maybe surgery or something. And in the middle of the night, you can imagine what happens. The hospital might be run by a single specialist, right, in the evening. And even the patient come up with a fever, and they could say, well, we don't have an infectious disease specialist. We don't have a respiratory physician on call tonight, so we won't be able to take you.
Yeah.
Right? They could say that. And of course, the most of these hospitals are private hospitals. So the government doesn't really have much say about, which patient the hospital should take. So I think it's, broadly speaking, it's like a structural issues,
Yeah. Yeah, the ambulance one I find really interesting. I've had one experience with an ambulance. My wife cut her hands quite badly. Luckily, didn't cut any major blood vessels. She was very close and ended up having 14 stitches. But what shocked me was we were sitting there for probably 25, 30 minutes in the ambulance while they were calling around. Asking hospitals if anyone could take her. When it was shocking, and she wasn't in a critical condition; she was in a lot of pain. And then they were asking her these questions regarding the incident, and very detailed, completely unnecessary questions. And it just took us forever to actually find a hospital that we can take her. And so that was a bit shocking. I mean, like I said, she wasn't in a critical condition, but if a family member or yourself was, I just wouldn't have any confidence in the ambulance taking us to taking you anywhere on time. And also, when you see the way ambulance drivers drive here, back in Australia, if the sirens are on, that you get out of the way of that ambulance, it's in a hurry to get somewhere. Here, there've been times where I've just been driving my car and I'm driving alongside an ambulance which has its lights on, sirens on, and is telling people to get out the way. Yet, I can remember pulling up next to an ambulance And we started at the same point, and I wasn't speeding, but I ended up passing them on the way to, I think they were going to the Hiro hospital, and we were sort of going along Gaien Nishidori. And it was just, if there was it was me or someone I knew in that ambulance, I would want you to hurry them up. It's
Yeah.
So yeah, the ambulance one I find very, very interesting.
Yeah. I mean, you're lucky you found a hospital in some way.
Right.
Because it's a very out of hours has always been an issue, I think, in Japan. And as I said, there's that, structural issues, but also being international, residents here in Japan wouldn't help either, because
Right, of course.
many hospitals would actually, decline patients. They can do that on the basis of, saying, well, we don't speak English here.
Yeah.
And that's really it's very interesting, because if we do that in UK or Australia, that would be a racism, what I mean?
Yeah, absolutely.
But when in Japan, it's almost a system is, healthcare system is such a way that, it's almost exclusively designed for the Japanese, and international patients are kind of extra in some way.
Yeah.
And I think, it's a really interesting point. I think that's one of the reasons why I felt so strongly about, setting up my own department of international healthcare. I think that's one of the reasons, because, the primary cares are pretty good in some way, when, the TOM, the Tokyo Medical Surgical Clinic, they're all pretty, they're supporting, and your physio, all that kind of thing. They're supporting the primary care needs of the patients. But I think that when it comes to hospitals, I think there's so much more we can do. There's so much more we can do. How we take care of the patient while they're inpatient. We're having just interpreters. Accepting as many international patients as possible. All that kind of thing. I think hospital can really help with that. The trouble, but you might not believe this, but in the last probably 4 or 5 years, probably Japan changed, try to at least change a lot in the last 5 years. The reason is, do you know why that is, Sam? What was a big event?
Well, the Olympics. I was going to say that. I was going to say that's too obvious, but yeah. Okay.
Yeah, the Olympic, right?
Yeah.
Yeah, but I mean, yeah, I think there was that Olympic game that I think has accelerated changes somewhat. But I think there's a lot more work that we need to do, and certainly there are a lot more work that we can do.
I guess for especially for people who are relatively new to Japan, what are there any sort of recommendations that you'd have, general recommendations for people in terms of dealing with the Japanese medical system, and in particular dealing with hospitals? Like you said, especially in Tokyo, we have foreign clinics that operate more like a clinic would overseas, but in a lot of parts of Japan that isn't the case, and people are having to access healthcare through the Japanese system. But also for people in Tokyo that have to deal with hospitals as well. Are there any sort of general recommendations you have for people?
I mean, I think the recommendation is that have a really good primary care physician, preferably the generalist in Tokyo, because that they could really act as a navigator, and there are, as you said, there are a couple of international clinics in Tokyo that are catered specifically for international patients. And there are a couple of hospitals that actually mainly cater for international, well, not mainly, but also cater for international patients. So I think, but I think the primary care physician, I think that's a really important, because they could really act as a navigator to your healthcare. Yeah. And particularly, if you are used to the healthcare in, for example, in UK or Australia or in Europe, where you're much more used to having a primary care uh, general practitioner or family physician, I would really highly recommend having your own doctor there, who can really advise you on your healthcare needs.
Yeah, sure. Let's say though, someone lives out in rural Japan and they don't have access to an international sort of clinic in Tokyo. Um, you said that there are some good generalists out there. Um, is there any tips in terms of how to find that person? I mean, do they tend to operate in certain types of clinics, or is it really just hit and miss?
I think that that it's unfair in some way because in Tokyo, I think we have more healthcare services that are catering the international patients, and I think in the rural area, that tends to become more difficult. But I think you know nowadays it's the remote health consultation is becoming much more common.
Yep.
During and then that's really the big change. It's a big change that we embraced in the healthcare during
Yeah.
after during the pandemic. So I think if you are actually living in the rural areas, you should really make the good use of the remote consultations. And
Yeah.
many of those um, hospitals or clinics now adopt remote consultation. So I say that use that, as
Yep.
much as you can. And if it's many of the healthcare issues, whether it's you could at least get an advice, whether the healthcare um, that you are getting in your rural area is correct or
Yep.
it's okay. I think you could at least get an advice from one of the physicians, even based in Tokyo nowadays.
Yeah.
So I say
Yeah.
remote consultation.
Yeah, that makes sense. And does your clinic offer remote consultations through?
So we have actually adopted the web online consultation quite recently, but we're not. Surprisingly enough, we haven't really had many patients who's asked for remote consultations yet. But I know that in many clinics, like Tokyo Medical Surgical Clinics,
Yeah.
where I do part time, they do a remote consultation constantly. At my hospital, it tends to be that because it's a cohort of hospital patients. So many patients, when patients are sicker, we tend to see them more face to face rather than
Yeah.
sort of remotely. But that's just a change, just a difference in the cohort patient that we see.
Sure.
But
Sure.
yeah. But I would like to adopt more online consultation. But yeah, thanks for your suggestion.
Yes. Yeah. Well, we people listening to this are primarily in Tokyo, but we do have people in other areas of Japan, and so they may be looking for an English-speaking general practitioner. So we'll provide your details, and they can get in touch and set up
Thank you.
a consultation. I guess I'm starting to wrap up. Are there any other points in relation to the Japanese system that you think are important for people to know?
I I mean, this is not something I suppose that individual could do, but I do think that Japanese healthcare. I think that at the point of a transition,
Yeah.
especially after the pandemics, it's very interesting because think about in Japan up to maybe around 2018, we were receiving almost 30 million tourists coming into Japan, and we're having more and more, international people coming into Japan, right? So actually, as a society, Japan is becoming, much more globalized than previously in the last 10 years. Um, but the healthcare, I think, has been very slow to catch up on that. It's just been it's maintained the traditional structures. So I think that one thing that I could say is that I think as an international resident in Japan, we do actually need to raise a voice, raise a voice to say, well, we need a bit of changes, we need some improvement in our healthcare, because otherwise, if the publics don't speak out, the the healthcare system will never change, So, and also the international residents, they deserve a better healthcare.
Yeah, yeah. Well, I think that's a great place to finish up. I think it's fantastic to have someone like you who's you've been trained overseas and is working in, obviously an international department, but in a Japanese hospital and in sort of in that Japanese system. There's obviously a lot of doctors working in foreign international clinics, but so I think that. Someone like you having a voice, and other doctors like Nick, I think working in that system is great, and having young people that with a young message and young voice, youngish. Well, I mean, when you look at the average sort of Japanese doctor that you see in hospitals, I think you definitely are the young. But so like I said, if anyone wants to book an appointment with you, what are your what days and hours are you at NTT? And like you said, you also work part-time at Tokyo Medical and Surgical. What are your hours there?
So we had at the NTT Medical Center, we have a clinic running weekdays from Monday to Friday. But Dr. Rennick also works from Wednesday to Friday at NTT Medical Center. For me, actually, I work at Tokyo Medical Surgical Clinic on Wednesday and Saturdays.
Okay.
But the rest of the week, I usually run a clinic at the Medical Center.
Yeah. Okay. Terrific. Well, thank you very much for coming on tonight, Ryu. We understand that you are very close to being a father for the first time. So congratulations in advance. By the time this comes out, probably in a few weeks' time, hopefully that will have happened. And so, wish you all the best. As you know, we've just had an addition to our family. So, welcome to the club when that happens. And like I said, thanks for the work that you're doing within both the international system, but also trying to work some of the international philosophies of healthcare into the Japanese system. So, and good luck with that going forward in the future.
Thanks, Sam. Yep, it's a little bit of an anxious time for me, being a father for the first time. But wish me luck. And thank you so much for having me here today.
You're welcome. We appreciate your time. Thanks, you.
Cheers, thanks.
Take care. Bye.